Hi, it's me, Brodie McLeod, back again today on YouTube with some more problems at the Signet Hospital that I'm at in Stoke, Weston-super-Mare. For about 2 weeks now, I've been asking for a dental appointment. I got a cracked tooth with half of it missing, which is really shit. And unfortunately, sorry, I had to pause it there. Just some people loitering outside the door trying to make themselves audible on the video so that nobody finds out. So I've got a really bad tooth. Cutting into my tongue really hurts. Yeah. Anyway, you're not supposed to phone 111 if you're a psychiatric patient because you're on psychiatric meds which can interfere with the anaesthetic injections that they give you. I tried to explain to staff several times, showed them the reasons why it's not supposed to be allowed and they need to speak to the duty doctor rather than phoning 111. But they were just like, no, you don't know what to talk about. We go to the 111. Oh, boo, 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 boo. And I was like, can I show you this legislation? And I'm like, no, you and just like, just sort of shut the door in my face and ignored me. And then I was just about to get in the shower, just turned up with a phone and thrust it into my face, like, here you go, 111. And I was like, okay, thanks for that. I've just told you exactly why this isn't the case for 111 because I'm a detained psychiatric patient on antipsychotic medications, multiple antipsychotic medications. The duty doctor needs to assess my needs, and you don't wait in the 111 queue if you're in a detained psychiatric patient. Anyway, don't believe me, I'm just a fucking psychiatric patient. Here's a document with a bit more information entitled Systemic Negligence and Clinical Endangerment, Failure to Provide Medical Care for Detained Psychiatric Patients at Signet Stoke. So executive summary of the incident. On insert date today, whilst detained under the Mental Health Act at Signet Stoke and prescribed multiple antipsychotic medications, I experienced an acute medical emergency in the form of a severe dental pain or infection. Obviously this is AI slot, but yeah, it should have everything in there. Despite being under the continuous duty of care, that's a big word, it's very relevant, not big words, but big emphatic point in this, of the hospital, the nursing staff refused to contact the on-site duty doctor for a physical assessment. Furthermore, when I explicitly presented the staff with the statutory guidelines and legal framework demonstrating why a detained medicated patient requires an on-site medical assessment, they actively ignored the law. Instead, ward phone was just thrust at me with the instruction to speak to 111, who were on the phone after like seconds, and book yourself an appointment. This document outlines how relying on public telephone triage algorithm system instead of an on-site physician for a detained, heavily medicated patient constitutes clinical negligence, professional misconduct, and a direct threat to my life. So clinical danger, how this puts my life at risk. By refusing a physical assessment by the duty doctor and deferring to an NHS 111 call handler, the ward staff placed me in immediate life-threatening danger. A non-clinical call handler working from a remote algorithm cannot visually assess a patient or safely cross-reference complex psychiatric pharmacology. Specific potentially fatal risks ignored by the staff include fatal cardiac arrhythmia, so QT prolongation. Prescribed multiple antipsychotic medications. Many antipsychotics prolong the heart's QTC interval. If a dental infection requires antibiotics, dentists frequently prescribe macrolides, such as erythromycin. Combining macrolide antibiotics with QTC prolonging antipsychotics can trigger torsade de pointe, a potentially fatal heart arrhythmia. The duty doctor must oversee any prescribing to prevent lethal drug interaction. A 111 call handler cannot do this. Adrenaline, epinephrine interactions. Dental local anaesthetics routinely contain adrenaline. When administered to a patient on a certain antipsychotic, which can often act as alpha blocker, it can cause a severe sudden drop in blood pressure, hypertension, and cardiovascular collapse. Sepsis and airway compromise. Dental infections can rapidly spread to the deep spaces in the neck and jaw. Ludwig's angina, for example, compromising the airway or entering the bloodstream, giving me sepsis. I don't think that's going to happen to me, but psychiatric medications can mask physical signs of fever and alter pain perception. A telephone operator cannot check my vital signs, palpate my lymph nodes, or look inside my mouth to assess for airway obstruction. The duty doctor can and must. The legal framework, verbatim breaches of statutory duty. The actions of the staff represent direct violations of UK law, statutory guidance, and regulatory standards. So the Mental Health Act 1983 Code of Practice says Ignoring it without a documented, heavily justified clinical reason is unlawful. So chapter 24.1, patients with mental disorder should receive physical health care that's equivalent to that received by people without mental disorder. 24.3, hospital managers should ensure that patients detained under the Act have access to a full range of physical healthcare services. Providers should ensure that there are clear pathways in place for patients who need to access physical healthcare. Chapter 24.4, patients with physical health should be assessed when they're admitted to the hospital and monitored regularly thereafter. Staff should be trained to recognise and respond to physical deterioration or medical emergencies. The violation, equating equivalent care with making a patient call 111 or them calling 111 and handing me the phone, is a fundamental misinterpretation of the law. I'm legally detained. I'm not actually legally detained, but I'm falsely imprisoned. I can't freely walk onto a high street dentist. The hospital acts as my primary care provider. Well, they're not asking me to do that. This is the AI getting it wrong. By offloading my physical deterioration to 111, the staff failed to provide a clear pathway and failed to respond to a medical emergency. So they've fallen short of the mark, basically. Health and Social Care Act 2008. As a registered facility, Signet Q-Stoke must adhere to CQC regulations. Number 12.1 says care and treatment must be provided in a safe way for service users. It goes on to say assessing the risks to the health and safety of a service user, receiving the care or treatment, doing all that's responsibly practicable. Very broad, open-ended scope of these terms, but the violation is the refusing a duty doctor's assessment and forcing a complex medicated patient into self-triage via non-clinical public hotline is the exact opposite of mitigating risk. It actively introduces the risk of misdiagnosis and fatal drug interactions. The Nursing and Midwifery Council Code, the registered mental health nurses, RMNs involved, are bound by their own professional code. Make sure that any treatment, assistance or care for which you're responsible is delivered without undue delay. Work with colleagues to evaluate the quality of your work and that of the team. Accurately identify and observe the signs of normal or worsening physical and mental health in the person receiving the care. So the RMNs have failed to assess my worsening physical health, delayed my access to safe medical treatment, and actively ignored clinical literature when it was presented to them by the patient. The negligence, misconduct and malfeasance explained. The staff's actions are not merely poor customer service, they meet the thresholds for formal disciplinary and legal action. Clinical negligence. Negligence occurs when a healthcare provider breaches their duty of care, resulting in potential or actual harm. The ward owes me a strict duty of care because I'm detained. By refusing to let the doctor see me, they breach that duty. If my infection worsens or I suffer a drug interaction because of this delay, they're legally liable for medical negligence. Professional misconduct. Misconduct is behaviour by a registered professional falls short of what can be reasonably expected. The RMN's refusal to escalate a physical medical issue to the on-call physician, coupled with their dismissive attitude, book yourself an appointment, constitutes a blatant failure to uphold NMC code. Malfeasance and reckless endangerment. So malfeasance is the intentional performance of an unlawful or wrongful act. I explicitly provided the staff with the correct policies and laws governing my care. They looked at this information and chose to ignore it. This transforms their actions from simple ignorance into willful, reckless disregard for my physical safety and my legal rights. Conclusion, psychiatric inpatient ward is a medical facility, not a hotel. When a detained patient suffers an acute physical health crisis, the trust cannot wash its hands of the situation by pointing to a telephone. The refusal of the Signet Q-Stoke staff to utilise the duty doctor for a heavily medicated patient is a dangerous, negligent practice that legally compromises the hospital and puts patients' lives severely at risk. And then I'm going to be making a video, blah, 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 whatever. Anyway, I might have a dentist appointment tomorrow. I might not. Maybe I'll die, maybe I won't. Maybe I'll go into some sort of severe dopamine fuckery and be sick all over the place. I don't know. Yeah, really looking forward to it. Thanks very much, Signet, and cheers for everyone else who's just completely terribly ransacked their dignity in their job today. Yeah, thanks. Cheers.